All right, future nurses, welcome. In this explainer, we're diving deep into anxiety and OCD. We're going to cover the core concepts and, most importantly, the critical nursing interventions you are absolutely going to be using in your practice. Let's get right into it.
Okay, let's just break this down for a second. That first part of the quote, we've all been there, right? That little jolt of stress before something big. It's totally normal. But that second part, that's the moment everything changes. That's when anxiety stops being a helpful nudge and becomes a wall. And as a nurse, recognizing that shift is one of the most important things you can do.
You know, it's so important to get this difference straight. Fear is easy. A fire alarm goes off, you feel fear. It's a reaction to a real specific thing. But anxiety, that's different. It's more like this vague, heavy feeling of dread that you can't quite put your finger on. And understanding that distinction is key because it helps you get inside your patient's world and really understand what they're going through. So, here's our game plan. We're going to start with the basics of what anxiety feels like. Then we'll get into a really practical framework for assessing it. We'll look at the line where it becomes a disorder, touch on OCD, and then, the most important part, we'll focus on your role and the powerful things you can do to help.
First up, the anxiety experience itself. Now, it's really easy to just think of anxiety as a bad thing. But honestly, a little bit of it is, well, it's essential for survival. It's what gets us to study for that exam or prepare for a big presentation. Without it, we wouldn't have that push to get things done.
So here's the clinical definition you really need to know. It's something every single one of us feels, but for some people, it can grow into this huge disruptive force. As a nurse, you are going to see patients whose lives are just consumed by this feeling. And knowing this definition is your very first step in helping them.
Okay, now let's get into a tool that you can actually use every single day in your practice. It's Hildegard Paplow's 4 levels of anxiety. This framework is it's invaluable for assessing your patients and figuring out what's really going on.
So at level 1, we've got mild anxiety. This is actually the kind of anxiety that helps you. Think about that feeling right before a test. Your focus gets sharper, you're a little more alert, and you're ready to go. That's mild anxiety at work, and it's actually making you better.
Now, as anxiety starts to climb to a moderate level, the patient's world kind of starts to shrink. Their focus narrows, they're not taking in as much from their surroundings. This is where you'll start to see those physical signs pretty clearly, maybe a racing heart, a shaky voice, that kind of thing. Okay, I really want you to hear this because this is a huge deal for you as a nurse. When a patient hits severe anxiety, their ability to think clearly just shuts down. They literally can't learn or solve problems. So this is not the time to try and educate them or ask a bunch of complicated questions. Your whole focus has to change. And the final level is panic. This is a true medical emergency. The patient is completely overwhelmed. Their behavior might be all over the place, pacing, shouting, or maybe just completely withdrawn. They've really lost touch with what's going on. And your number one immediate job is to keep them safe. This table right here is your cheat sheet. It lays out the 4 levels so clearly. Just look at how things change. The perceptual field goes from heightened all the way down to being unable to process anything. Problem solving goes from effective to totally impossible. Seriously, burn this table into your brain. It's going to be one of your best friends as an assessment tool.
So, we've seen the whole spectrum of the experience. But where's the line? When does this completely normal human feeling cross over into a clinical disorder that you need to intervene on? Let's take a look.
Let this number sink in for a second. Almost 1 in 5 adults has an anxiety disorder. That means it doesn't matter what floor you work on, med-surg, ER, pediatrics, wherever. You are going to be caring for patients with anxiety every single day. This is everyone's business.
Okay, let's zero in on panic disorder. The 2 big words here are recurrent and unexpected. These attacks often feel like they come completely out of the blue, and that unpredictability is what's so terrifying. Patients start to fear the fear itself, just constantly worrying about when the next attack is going to hit.
And this explains so much. This is exactly why people having a panic attack rush to the emergency room. I mean, look at these symptoms: palpitations, chest pain, a fear of dying. They think they're having a heart attack. It's your job to recognize what's really happening and provide the right care, even when everything feels chaotic. All right, let's just briefly shift gears to a group of related disorders. Now, obsessive-compulsive disorders aren't technically classified as anxiety disorders anymore, but they are absolutely driven by anxiety, so it's critical that you understand them. So here's the cycle, and it's a vicious one. The obsessions are the intrusive, unwanted thoughts that just pop into their head and create massive anxiety. The compulsions are the ritualistic things they do, like checking or washing, in a desperate attempt to turn that anxiety down, even if it's just for a little while.
Okay, now we get to the most important part of all of this. What you, as the nurse, are actually going to do. Your entire game plan is going to depend on the patient's level of anxiety, which, hey, you now know how to assess. So let's look at how to tailor your approach. Your whole approach just completely pivots based on how well the patient can process what's going on. At those lower levels, you're like a guide, helping them think things through. But when they're at severe or panic levels, your role shifts completely. You become a protector. Safety is the only thing that matters.
So when your patient is in that mild to moderate zone, you can actually work with them to problem solve. Use those open-ended questions to help them dig into what they're feeling and figure out their triggers. You can even suggest going for a walk to burn off some of that nervous energy. The goal here is to empower them to get back in control. But when a patient is in a state of severe anxiety or full-blown panic, they are terrified and they are not in control. Your calm, steady presence becomes their anchor in the storm. Your actions have to be direct and supportive. You use short, simple sentences. You don't ask them to solve anything. Your only job is to ensure safety and start bringing them back down.
So as you head out into your careers, just remember this. All the frameworks and theories are essential, but the most powerful tool you will ever have is your therapeutic presence. Your ability to connect with another human being with calmness and without judgment. That is what truly helps people heal.